today as we get into a conversation, a bit of a sticky one, but we're going to do it all the same. We alluded to some of these things throughout the whole week, and it's time for us to have that conversation with you. When we talk about situations in the country, sometimes we're not really in tune with what exactly is going on. And this Friday, in this hour, we turn our spotlight on health. Not talking about the system. We're not talking about what Shah did or did not do. We're not talking about what Schiff is doing or did not do. We're not talking about what the Ministry of Health is doing. We're talking about situations in which Kenyans are walking themselves into facilities, unfortunately, not getting what they need. And we are going to talk about those issues. It is going to be difficult. It's going to be tough. But we are going to talk about them anyway because we need to. Oftentimes, in search of a solution, you have to turn or take the lid off the ugly, and so that we can have hope for what it should look like. And so we get into that conversation this hour. But before we do that, Mark, you want to remind us about today's proverb?
Well, the proverb is about turbans. Mm-hmm. Where the turban goes, there the territory will follow.
Where the turban goes, the territory will follow. Where the leader goes, the people will follow.
Yes.
Where the wisdom goes.
But also, in my view, it is also about the winds of change, the winds of time. For example, these Trump winds. If you work in the NGO space, the territory has followed the turban.
Indeed.
Speaking of winds, the other analogy for me is, if you decide to blow wind and you walk away thinking you've left it behind you, the wind will be following you.
And here I was thinking, okay, here we go. Dennis is about to be really deep here. Let's deep. Let's follow. It is quite... My goodness. Okay, so... Focus.
Can I read something?
Read it.
This is total coincidence. There's a lady called Just Kabura, right? And she was in hospital on Wednesday to deliver her child. And instead of delivering her child, this is the story she wrote on Instagram. Just underscore Kabura says, Amaya Leilani, my baby girl, died in my womb on Wednesday around 1 a.m. and I gave birth at 9 a.m. She is a person and didn't deserve to die like that. I really didn't expect this, how I was going to announce that I have been pregnant this whole time. My heart is broken and I'm so mad I can't even find the words to describe what I'm feeling. Her life mattered and justice will be served. Name of hospital withheld in Imaradaima, killed my baby due to negligence. I had to run away bleeding. Let me start again. I had to run away bleeding, naked, with a urinary catheter between my legs, barefoot, and with a dead baby inside my stomach to save my life because the doctors decided to go and hide and left me on a theater table alone after realizing they had effed up.
That is criminal. It's oh my God. You know, some of these places are actually not hospitals. And you hear stories like that, and it's not uncommon. You realize these are death traps. They're actually not hospitals. It's just a hospital by name, but that's the reality. And if you think that it's only those who can't afford to go to a hospital who suffer these things, we who can afford have also seen things. And every time you think of either going to a hospital, you actually freak out.
Yeah.
You would assume if you're unwell, or in the case of that lady, sorry to her, you think you're going to hospital to seek refuge, you're going to get help. You're going to deliver a baby. You've carried this baby for 9 months. You're going to deliver a baby. Whatever complication is there, you expect something is going to be done. But when it reaches a point of abandonment, where she says, as you've read, runs away to save her life, carrying a dead baby in her womb,
Yes.
and it's in a hospital. I don't know what levels of humanity we've reached as a society, or lack of professionalism. It's despicable, to say the least.
You know, and to just underscore Kabura or Kafura, pole sana. I say pole sana because my history with hospitals goes way back. And one of the stories that I remember, that even as I fight tears for this young lady and her child, is I remember when my sister delivered a baby, and we discovered later that not the whole placenta had come out. And I had to use significant influence to get the hospital to admit that they had made a mistake and to treat my sister. And I wish that that was one story. But as I sit here, I can tell 10 that are not mine and 10 that are mine. And that's what we need to discuss. When we watch TV shows and we see ER doctors and Dr. House and the rest, and we see them fight tooth and nail for their patients, then I remember that a good friend of mine was having a baby 2 weeks ago. And I had to be there. Not just to be there for him and his wife, but just to be there to make sure nothing would go wrong. I'm not a medic. But I have learned to approach hospitals with a warrior stance. I have to go and fight. You have to fight for attention. You have to fight to be believed. You have to fight to be served.
But why? Why? And I think that why question will probably open up the conversation a little bit more, because the sheer numbers of the stories that we hear, the experiences that people go through, where people die, where people then have lifelong conditions as a result of complications that should have been taken care of in hospitals in the space where we live, is a bit scary. And that this lady, as a point of contact for the stories that we'll share this morning, has lived through a horrific experience whereby her life was in danger. Obviously, the life of her child then cut short, and then having to live with the horror and trauma of that experience for God knows how long. Are we seeing that there's a heightened level of carelessness, nonchalance when it comes to the health, or are we just dealing with unprofessionalism? Sad to say that we do have medical facilities in this country that are manned by folks who are not medical professionals. One. Sadly, we also have had people who have lost their lives or gone through complications in facilities that are professional organizations. What's the problem? Why do we see so many? What's happening?
I think it's a breakdown of so many things. I'll give an example, because you've talked about professionalism and so on and so forth. I remember several years ago, I did a story on a doctor calling himself Dr. Mugo. I exposed the man. I think he's still in jail today. When I went to his clinic, well, I didn't enter the clinic. I was working with somebody from the inside to cover the story. For 1 whole month, I had a hidden camera inside his hospital. And this person who was helping me film everything that was going on would come back to the station. I'll review the footage, hours and hours of footage. Then I will just edit, keep what was needed. And the entire time, as a journalist looking at the footage, obviously there's something I was looking for. But then I took a step back, and then I realized they're actually human beings walking in and walking out with prescription drugs, having had injections. Now, sad enough, there are some, and these are women, who are actually sexually abused by the man after getting an injection, knocks them off, and then he pretends to be attending to the patient, and he abuses them. By the time the patient is waking up, they actually don't even know where they are or what has just happened. And I was watching this video. I didn't realize how it was affecting me until later on. So when I was looking at these people going in, of course the clinic has a name. He has, whether they are real or fake, he has these licenses on the wall. But people go in trusting that Daktari utanitibu. They believe when you wear that coat, you have a stethoscope, that you are going to treat them. So there is this trust that people have when they go to a hospital that you are a professional and you merit being there. So in return, when some of these things happen, like in this case, that's when you realize, even in some of the big hospitals, there's some malpractices there. I'm not just talking about a small clinic in Kayole or Madare. I'm talking about big hospital, tier 1s and tier 2s. We've seen those kind of cases happen, you know. If it is not being asked for money first, because I've had, you know, experiences where you question a doctor, what's going on with my child? They're not able to tell you. And you're intelligent enough to know they're just taking corners and taking around in circles. And all they want, and unfortunately, as long as you have insurance cover, you are the right candidate to be fleeced. That's a whole subject altogether. So the first thing they ask you before treatment is, where's your cover? Where's the money? Where's the deposit? And you're dealing with an emergency case here. My personal experience, and this is so unfortunate, my daughter was unwell and in the ICU, in a coma. Barely a week, I'm trying to figure out what's going on. I'm slapped with a medical bill. It's not in a few thousands. It's a couple of millions. And I'm thinking, where am I getting all this money? And you're telling me I need to pay half of it by Friday or else.
Or else what?
It's a dotted line. Or else. It's a dotted line. They leave you to figure it out. So you are under pressure to understand what's going on. You're being pushed to look for money to pay. And at the end of the day, you're actually not being told what's wrong with the patient. So you have to live with your loved one, whether you know what is going on with them or not. That's how it is for so many Kenyans in this country when they're going to the hospitals.
Do you know, Dennis, I was doing research on the entry of these funds that come in to expand hospitals rapidly, right? And I was doing the math as to why they like Kenya specifically. Now, I'm sure you've realized that many hospitals nowadays start off small, they're good, and then they expand very quickly, right? So let me tell you what happens. A good hospital means that you've got a good doctor to patient ratio. You've got experienced nurses, you've got experienced administration, and you've got an efficient system running, and you're profitable. When these funds come in, they offer you 3, 4, 5 billion, right? And they tell you they're taking over 30% of your hospital, and then it's a good deal for you. You're an entrepreneur. Then what happens is two very interesting things. Number one, they immediately fire the experienced staff. And then the consultants they begin to do these things they call consultancy. So they're there in the morning, They do rounds, they're gone. The people who attend to the patients then are reduced to medical officers and sometimes trainee doctors. The first person you're seeing is not as qualified as it used to be. Correct? Now, apply this destandardization all through the hospital. Right? So it means that the experience of the staff is reduced. Why? Because the easiest way to make an organization very profitable is to make the labor cheaper. That's one side. The other side of what they do is they then give doctors, or in this case, clinical officers in some cases, a quota of people to admit. So you're told that today you must admit 100 patients. Must. Does not matter whether in your estimation out of the 120, 150 patients you saw, only 20 deserved to be admitted. If they see that card of yours, admission is very likely. In that space, what happens then is if you have a complicated issue, okay, it means the detection of that complicated issues, instead of taking a day, like in your case, it might have, it will take a week or two. Because a complicated issue requires that you have 3, 4, 5 experts. In my case, it was a neurologist, an endocrinologist, God, I've even forgotten, there were like 5.
Another gist.
Yes. And because they're all consultants, it's very difficult for them to come and meet at the same time to come up with a combined diagnosis. So you find that some key issues that should be escalated are not escalated quickly enough. And then, what does that force you to do? You've got to go doctor shopping. For your diabetes, see 5 doctors. For your migraines, see 5 doctors. Get 6, 7 tests done per day, right? In fact, guess how many tests I've done this year? Before they found what was wrong with me. More than 60. More than 60 different tests. Because the system as it is today is not centered on the patient. It is centered on commerce and lowering costs.
You know, speak of commerce. I happened to be in a meeting. This is a real story. In a meeting, I had a patient. So I was pleading with the hospital because I wanted to figure out what's going on.
First.
I could clearly tell they're stretching, like Mark is saying, you're trying to stretch the days of admission, but I want to understand why admit for this number of days. Who are all these doctors? What exactly are they looking for? So I'm sitting in this office, and somebody walked in from NHIF. And as they're having this conversation, this is the finance office of the hospital. So as they're having these discussions, I'm just sitting there. And for some strange reason, the 3 talking inside that office almost forgot that I actually existed. So I'm listening to this conversation where the hospital finance officer is asking this gentleman from the NHI, a very senior person from NHI, that, oh, you guys, we're actually claiming a lot of millions, almost 500 million from you guys. You're not paying us. What's going on? We need this money for expansion. They're expanding the hospital, creating another facility. And they ended up, to cut the long story short, discussing figures. And they were talking about how much money they needed to raise within 3 months because of the expansion. They have deadlines, and they need to pay suppliers. They need to do all these things. And they're looking at vis-a-vis the numbers that they're generating from the hospital in terms of revenue. And how they were having this discussion, they're not talking as if these are human beings or patients who are sick in the hospital. They're looking at profit heads.
Yes.
Okay? And the conversation went further. So when I was talking to one of the doctors, the doctor pulled me to the side and said, Dennis, it's unfortunate that this can actually even happen to you, because in reality, what's happening is departments have targets.
Yes.
To meet their targets.
Yes. This is a hospital. So pharmacy, they will have a target. Inpatient, they have a target. Outpatient, they have a target. The lab, they have a target. So if your target, for example, is 5 million at the end of the month, and you're on date 25, you still have 5 more days to go, and you've not reached your target. Guess what happens to the patients who walk in, like Mark was saying?
Every patient who walks into that place is going to be asked to go to the lab.
You're a customer.
Yes.
You're not actually a patient, you're a customer. And there's a way they will package disease in an envelope and give you all these documentations of all these tests that you need to do. And you have no room to question why.
Because they're the doctor.
Exactly. So then you get into the hospital. Somebody walks in. I had that experience because I had a surgery. Someone walks in and tells me, Dennis, lift up your left hand. I lift, and then they walk away.
Yeah.
Guess what I was billed at the end of 3 days? 145,000.
For lifting your hands.
For just lifting my hands, putting it down. I may understand maybe there's something they're looking for, but I had like 3-4 people walking in, walking out.
And that
I'm
person
being
is
billed.
a consultant, for
Yes.
example, of some physiotherapy, something. Okay.
Exactly. And so, apart from being death traps, these are basically, as somebody once told me, Dennis, these are thugs who are profiteering from sick people. And
So
that's why people opt to go to India, for example. Even the politicians know, and that's why you will rarely find a politician going to a local hospital for treatment. Even delivery, they have to go to country outside Kenya
to have
because
the
you don't
babies.
trust your own hospitals.
We've gotten to the point where the commercialization of health far outrides now the treatment of several individuals, right? And we're not necessarily just talking about the actual brick and mortar treatment that a doctor sees you and says this needs to happen. But we're talking about a system whereby, like you say, the patients who would previously come in and the health is optimum, or the health needs are optimum in terms of priority, what we're looking at now is bottom line. It's the bottom line that is being sought after now. Now, when you couple that with, unfortunately, the mediocre treatment that we see for many people, it's really a very, very sad state of affairs. You will go and you will get a diagnosis for something that you've not been tested on. How does somebody look at you, for example, and tell you that you have an infection? It is not possible. Just by your symptoms, I can tell that you have this, and then you're taken to the lab. It's interesting because Victor gives an example here, and there are very many people getting it on socials this morning. Victor says, these guys are forcing a surgery on my nephew just because of an inflammation from an infection. And I said, no, the inflammation cleared in 3 days. And he said no to the surgery and then stayed at home for another 3 days. And that essentially all cleared up. They say that the three people that you believe the most, your teacher, your priest, and your doctor. So if the doctor tells you something is wrong just by them looking at you, because we assume that you've been to medical school and you get what it is that's going on, the likelihood of you taking it at gospel truth is very, very high. But are we sacrificing people who are sick on the altar of commercialization when it comes to the healthcare sector? And it would appear as though it is. How many people have died? How many people have gone in to have surgeries that were unnecessary? How many things have happened that didn't need to happen? And we leave people then now languishing in squalor because of decisions that were taken over finances that they needed to go and get for procedures that they did not need. Is this not the situation that we are in today?
Let me tell you, whenever I go to hospital, or if I know someone who's gone to hospital and you're given prescription drugs, my advice is, first, check the expiry dates, because a lot of times we don't do that. I've had an experience where I've been given expired medicine. And because a lot of times you will trust an institution that they will have everything right.
They're reputable, maybe.
Yes. So they will pack for you everything, then they tell you take this 3 times a day. You immediately start taking those medications without checking a lot of these things. First, you check the dates. I have to check the contents. I actually Google. Every time I receive any prescription, I actually Google, because there was a time, I remember again, I was unwell, I get medication, and the prescription that I was being given this medicine will fight this one. And it will have a serious side effect on my body. I called the doctor and asked the doctor, you prescribed for me to take this, but I'm seeing here this medicine is going to fight this. And in return, what's going to happen, it's going to fight my body. And I'm already having these side effects. Then he said, no, then let's decrease the dosage. Instead of 500 milligrams, let's do 200. I'm like, how are you experimenting on my body with drugs? Am I a rat, you know? And that's the situation where we're in. And it's because, one, they will prey either on the ignorance of people or on the trust and the desperation. You trust, like you said, you trust this doctor. So when you go, you believe. One time I walked into a hospital, I just cut my finger with a glass. I went to emergency. So I get in, I'm treated. So they did a couple of tests, so I didn't cut any nerves, so the finger was okay. So I'm sitting with this doctor because, again, you have to pay for consultation.
Of course.
So I pay 6,000 for consultation. Then the doctor is looking at my arm and says, Dennis, did you have breakfast this morning? I said, no. I was actually getting the cup to have coffee, and it fell, and it cut my finger. Good. Did you come alone? Yes, I did. So I think we need to go for surgery. Do you know, I drove myself to hospital. I ended up on an operation table in the theater.
For
Same
what?
morning. Same finger.
What had changed?
You know how the doctor will begin to explain things. If we don't do this, we need to do this. Otherwise, you'll get this infection. You'll do this, do that, do this, do that. I ended up being operated on.
No, you didn't.
Yes, I was. They obviously saw I have an insurance cover. And I woke up in the afternoon in the ward.
What did they operate?
The finger.
For what?
They needed to save the finger. And they said
Had
they
you
could be
cut a
damaged.
nerve? Had you cut
No,
the
I
bone?
didn't.
Had
No,
you
I
cut the
didn't.
bone?
No.
Okay.
Are you kidding me?
2 days I was in the ward. People are coming with flowers. I'm like, I can walk.
I broke a cup.
I can walk.
I broke
What's
a
going
coffee
on?
cup, for God's sake.
People are coming. You know, and somebody hears, Mark, if I hear today you've been hospitalized, you're admitted.
Well, when I'm hospitalized, it's serious. Right
It's
now.
serious.
Yeah.
But if I come with flowers and
You're also wondering.
and juice and fruits, then you are actually on your phone. You are laughing. It's just a big protruding bandage on your finger. I'm like, you can go home, recover from home. You get what I mean? That's where we are.
Dennis, I understand where you're coming from. You know, I had a surgery 2 months ago, right? Now, let me give you a bit of background, right? I started being sick in 2021, right? And it progressively got worse and worse and worse and worse, and didn't know what was going on. Met very many doctors, and this I must say, I think over the course of my illness, I met over 20 different specialists in this country, and I met some very amazing people. So it's not everyone. But when I had my surgery, first it was prepaid, right? So I paid all of it beforehand in cash, because insurance, some surgeons do not want you to pay via insurance because insurance takes long to pay them back. That's another story. But I'm in pain. I literally had written my will, had called my best friends and told them, listen, Mark Bichachi is out. I'm done because it's been 4 years. My pain is just getting worse. I used to hug people. I tremble. I finish the show. I am on painkillers the rest of the day. It was a mess. So anyway, miracle happens. This doctor from India recently moved to Kenya. I go see him because of my migraines, which is a totally different story from the rest of what is going on in my body, or so I thought. Then he looks at me and he's like, hey, bro, you realize that all of these symptoms are caused by one thing? I'm like, what? You can't be serious, because I've been seeing X number of experts. So he says, anyway, we can do surgery. Long story short, do the surgery. It works, right? I'm supposed to be discharged. Okay? I tell these people, I'm like, listen, I have prepaid. Okay? I need to go home. Doctor has discharged me. in fact, the slowness didn't start there. After surgery, you know how they put you in recovery? After recovery, they kept me waiting for 2 hours for a gurney to take me to the ward. That's another story. But now, it's time to be discharged. I tell them, listen, I'm giving you 2 hours. And if you don't give me my discharge papers, I will walk out of this hospital. We reminded them every 30 minutes.
Why were they keeping you longer?
Because there's this thing about being discharged. That's why I've related it to Dennis's story. I've been discharged from hospital enough times to know. Look at that bill. There's always things that have been added that you didn't use. Visits by experts that you did not receive.
For raising up your arm.
Yes. So you need to sit through that bill and make sure that there is not an extra 100,000 that you're being charged because you say it's insurance. You just pay and go. What they do is they spend so much time discharging you that you're so frustrated you don't want to look at that paper. Right? But I had been in hospital Ndu for so long. I am even due for a checkup as we sit here today. I'm afraid to go to hospital.
Because you don't know what is going to
Because
bear.
it's just traumatic. Do you know I walked out? I got out of bed, dressed up, got into the lift with my big bandage on my head and walked out of the hospital. That's the only time they were able to give me my papers on time. By the time you are retaining a patient uncomfortably simply because you want to prove that you can milk the most amount of money out of them, then that Hippocratic oath that you took has severely been damaged.
There's a problem. We can't run away from it. There are too many stories for it to be normal. There are too many stories of folks who have either been fleeced. We started off this hour talking about this woman who had gone to have her baby, left with her baby, dead in her womb, and for all intents and purposes, a catastrophic situation. How many people go through this situation where we say the commercialization of healthcare has overtaken the treatment of the sick? That's the conversation that we're having this morning. It rounds up a Healthy Friday conversation today, and we're asking that question. Too many people are suffering. Where did this all start from? How do we handle it at 21 minutes to 10? Good morning. All right.
Kenya thrives on agriculture and it's very fruitful. From the highlands that we grow our coffee and tea all the way to the resilient northeastern part with our livestock, and not forgetting the breadbasket in the Rift Valley.
If you're not able to meet an agronomist, you can even view channels whereby you can start from the bottom.
Maisha ya siku hizi ni kujituma. Hakuna haja kwenda kutafuta kazi, na kazi yenyewe iko hapa kwa mchanga.
At Farm Kenya, we celebrate those who make it happen. Farmers who innovate, adapt, and guess what? They're able to feed the nation. Together, we are growing nutrition.
Together, we are growing agriculture.
And together, we are growing Kenya.
Shiba, Utashiba, Fugo Calf Starter Pellets, Calf Grow Pencils, Heifer Grow, Dairy Milk Plus, and Maxi Milk Plus, products of Unga Farm Care.
Negligence that we see has increased over the years. And when people are actually paying attention to what a patient is saying, are we looking at the commercial over the treatment of patients today? That when people die because of some kind of negligence, are we looking at it and saying that this should actually never happen again? But if we stick onto the commercial side of things, how much money in the hundreds of thousands to the millions are people having to fork out for procedures that are unnecessary? And where did we get to the point whereby for healthcare, for medicine, for treatment, that money then became more important than the treatment and health of people? Where did we get there? On what moral ground do you have to put somebody in a medical facility who is untrained, that is performing CSs on women, that is treating people and giving them medication and treating them for surgeries, that does not have a medical degree, or whose shadow has not darkened the four walls of a classroom to be able to earn certification to do these things? But people are walking in, and we say that we have a system that is operational. It is not possible.
Do you know the number of people walking in this country with after surgery, walking with things in their bodies? I have a friend who's a lawyer who took his son, a 10-year-old son, for surgery. And by accident, commission or omission, they left an item inside his body. They've already closed him up. So the boy can't articulate the kind of pain he's feeling. So the father, this lawyer friend of mine, kept buying medicine. The young boy is in and out of school. By the time they're going to do an X-ray to figure out why is this pain, it clearly showed there was something that was left inside his body. Today, it's a legal issue, because if you want recourse in this country for medical negligence, you'd rarely go anywhere. Let's be honest, you'll rarely go anywhere. It will cost you a lot. And this is a lawyer. The whole case has taken years and years to solve. The hospital has refused to admit that they are the ones who made that mistake.
I'm sorry, but how?
They're not admitting that the doctor who operated made that mistake.
How else do you have a foreign surgical object in your body if not through surgery? You don't swallow a speculum. How do you get something like that in your body?
You know what they've been telling him? And what he actually called me seeking help and said, can this thing be highlighted in the media? This is a lawyer who can afford to push this case. You know what they said? We are investigating.
You know, maybe the item was working on the corridors of the hospital, then it slipped and fell when the surgeon was doing his thing. Yeah.
How many more cases of things like this do we have to deal with before this is handled or paid attention to? Notwithstanding the number of cesarean sections that we see prescribed by doctors that are actually unnecessary. The natural way of giving birth is the natural way of giving birth. The cesarean section actually should be used when there is some kind of complication for the mother to then be delivered of her baby. However, we also know that in order to perform a cesarean section, there is an element of money that comes in. It is more expensive to have a cesarean section than it is to deliver the normal way. Now, we have had quite a number of those that say, well, you know what, I'm seeing certain complications. The best way for us to go about this is if you have a cesarean section. And I think these are some of, not that I think, just from what we see, the stories are the numerous stories of women who have been told the best way for us to do this is for you to have a C-section. And if we're looking at the costs of that, you're going anywhere between 50,000 to 150,000 shillings on the lower end for this procedure to be done. It all points to the same thing, that why do we insist on the commercialization of healthcare when it is a responsibility to make sure that people are better, that they are well, and then not being able to take responsibility should something go wrong later? There are too many cases. There are too many cases of neglect.
We lost we lost the moral code. We lost integrity. There was a time when the profession was actually a calling. For you to say you want to be a doctor, it's not just a career path. It's actually a calling, because you are helping people. You are saving lives. But the greed that comes with it, because you need bills to be paid. I mean, we were just talking about this yesterday, and you're saying the expansion of hospitals, especially when you're coming up with these satellite clinics, it's a brilliant idea. You're basically moving services from a major hospital that is extremely busy to where the people are in the villages or in the estates. It's a brilliant idea. But like the case I pointed out, I'm explaining my symptoms, and this young person, and I can't fault this person, is because they're being pushed because you want to expand, which is the biggest hospital, which has this number of clinics in all these spaces. They're actually on Google trying to figure out what my symptoms are, and they reach a conclusion that you have spinal arthritis. And I'm thinking, wait, I sit for long hours behind my computer. They actually told me, go do this x-ray, go do this test, go do this test for the bones. Costs around 50,000 at the time. I walked away, took painkillers, and started watching stretching exercises on YouTube.
And you were fine.
And I was fine.
No, but you did the same thing as your doctor. You Googled.
Exactly.
You and your doctor. Same. But what's important is, first, there are very good doctors out there, and I can't overstate that enough. There are very good doctors, nurses, and by the way, not much gets said about nurses, but there are wonderful, wonderful nurses in this country who, by the way, in some instances have actually saved lives because they took the slack from a doctor. Let's pay kudos to them. But the main problem here at the center is the lack of the sacredness of life. As a country, we take life as a joke. So let's take what Dennis has said. Let's say that he actually believed that he had arthritis of the bone. And let's say between the tests, they give you meds for arthritis that have side effects, etc., etc. And this person is doing that off of Google. What is the value of your life at that point?
There's no value there.
There isn't. At that point, there's no
It's
value.
what I'm able to pay, the consultation fee, the drug fees, and that's it.
Exactly.
I'm just one more person who's actually making them meet their targets at the end of the month.
Yes. Number two is the fact that healthcare is mostly done by doctors, but run by business people. So the doctors want to do the medicine, but the people who actually run the thing are not medics.
And they want a return on the investment.
Absolutely. And, they're looking for a situation whereby you would come back to them. Probably the most difficult thing I will ever have to do on this show is talk about my experience. On the 1st of September, this year, 2025, my son would have been 17. I was pregnant with this baby. And I, of course, had no idea what I was doing. And I had a doctor who, at some point, I knew something was wrong. And I called her and I said, something is wrong. And I am just not feeling like everything is okay. I mean, I've never done this before, but something is wrong. So she said, okay, come to hospital. One of the biggest, best hospitals in this country. Come to hospital. She wasn't there. She just said, well, just go and they'll find you and you'll say, okay, fine. We did a test, okay, and as is the case for a lot of pregnant women, it's not a UTI, okay. Well, they said it wasn't, so we said we keep it moving. And I said, I was with my husband. I said, you know what, something is wrong. And they said, well, no need for us to do a test. You'll be okay. And I believe that was the phrase I used. Something is wrong. And we did the first test. I don't even, till now, I don't know what the results of that test say. But it was a Sunday morning, and we sat in this hospital for maybe 6 hours. And unbeknownst to me, at that point, I was leaking amniotic fluid.
What?
So obviously at that point, my baby was dying, and I didn't know. But I'm not a doctor and I'm not a medical professional. And I was in a hospital where there were nurses and there were doctors and there were lab techs who did tests, and they didn't find out what the problem was. And my baby died the next day with an "I'm sorry" from the doctor. But what she did the next day was prescribe medication for me that essentially I went into an unintended abortion, which I should have had no business taking on that day. And my son died on the 1st of September. And if they had paid a little bit more attention, if somebody had done what they were supposed to do, I would celebrate my son's 17th birthday this year in September. It's 17 years later, but it's very difficult for me to talk about it. But how many people go through situations whereby we just needed you to pay a little bit more attention?
Yeah.
We just needed you to do your job. We just needed you to not be concerned that you can prescribe 10 different tests, as opposed to looking at me and saying, what's wrong? This is the situation. This is the thing.
You know, it's supposed to be
okay.
professional,
Yeah.
but
This is too much.
love is professional.
It's okay. It's okay. How do we even end this show?
How do we?
We don't. Because that pain doesn't end. That
God has given you strength.
grief
Yeah, God has
doesn't
given you that
end.
strength. 17 years.
17 years.
Yeah.
God gave you that grace and that strength to be strong.
You know, Kenya, if you are listening, we are not doing PR. We're not doing this to attack a hospital, to attack an individual. We're doing this because we have personal stories.
Oh God.
When Dennis talks about his daughter, that person is real. When Du talks about a child 17 years ago would be turning into an adult, it's real. When I touch the back of my head and remember how much pain and how many bills I had to pay, it's real. So we're not condemning a sector. We're just saying, as a country, as a people, we're not ending this conversation. We're saying, can we do better? Please. Can we just care that much more? Can we hurry that bit more? Can we inspect that bit more? Can we value life just a bit more than we value money? Please. I don't know what else to say.
You know, it's so painful to lose a loved one. I almost lost my own daughter, and oh God,
We can do better.
Yes, we can.
And all of the things that we talk about, I mean, it's very difficult. But all of the things that we talk about, whether we're talking about healthcare today on this program, as we do every day, whether we're talking about education, whether we're talking about responsibility, and I say it all the time, how much value do we place? Where is the value that we place? Value placed on things that means even if you make a mistake, that you bear the responsibility and accountability for it.
Yeah.
Even if you've gone wrong, you can